Well, good morning, everybody. It is August, what is it? 26, 2024, and it's the favorite time of our week because it's Mondays with Bev and Paul. And hi, everybody. My name's Paul.
Well, good afternoon from
That's
Indiana.
right.
This is Bev.
That's right. Bev is not in Arizona. She's in
Right.
Indiana. What part of Indiana?
It's outside of Indianapolis. Yep.
Indy. All right. She's out there visiting her son and his family, daughter-in-law, grandson.
Grandson.
The
Yep.
whole kit and caboodle drove out for 2 days with her daughter. Oh my God,
Yep.
just becoming a family woman here.
Just a family affair. It's wonderful.
What a
Yep.
mom. What a mom. All
Got my
right.
two babies together. Yep.
Right, a baby that towers above you. How far?
Right. Big time. Yeah.
All right, everybody. We're going to build off of our little workshop that we had. It was on carpal tunnel syndrome, but there was one key part that Mara talked about, and that was mindfulness. That she
Hmm.
worked with people in mindfulness. And how does that all relate to BioTouch, and how can we help with our carpal tunnel syndrome with mindfulness? So our first question always becomes, what the hell does mindfulness even mean?
What does that mean? Well, it's being bantered around quite a bit, isn't it?
Yeah.
So, yeah.
So and how does that
So,
apply to BioTouch? Because we don't usually use the word mindfulness.
no,
We use a
no.
we use a word we think is a lot better than that. It's called self-awareness. Mindfulness to me always reminds me of a mind full of ness.
What? A mindful of what?
Of what? Just full. It's just always full. It's
Just
always
full.
trying to figure out what to do, how to do it, how
Oh,
to improve your life, how to get better. It's a doing. It creates a lot of
yeah,
conflict. And I
yeah.
understand what Mara was trying to say.
Right.
She wanted people to be aware of where's your pain. So she's talking carpal tunnel, but trace it. Trace it back to its cause. And that's really the keynote of
Boy, that's
BioTouch.
that's a powerful thing. Well, when you do that, you're going to be part of the process of healing. When you are aware and have dialogue within your body, it's not outside of your body. It's your body, your journey of self-awareness, and it's you have to looking at, trying to figure out, well, where is the pain? And where in that area, what does that mean? At
Right.
least come into a place where you are not going, I have a pain, let me run to somebody else. It first starts with you being self aware that, okay, this is where it's at. Let me just be present, which is a lot of what BioTouch lets us do, not just with another person, but within ourselves.
Right. Right. And a lot of how we teach the system even for the practitioner. Don't just stick with where the pain is. And we talk about the nerve trains, that go
Yeah.
to the spinal column. And she talked a lot about that and being aware of, oh yeah, when I move my neck that way, I feel the pain here. And BioTouch, just that light touch, helps us wake up to tracing that pain that might not be, as she said, it might not be carpal tunnel.
Exactly.
you know
Exactly.
that's just a symptom that you put, you look it up on Google and it said, oh, carpal tunnel, or you go, we actually had a physician, the father of a couple of our practitioners, and he showed us different things you could test, and that if you moved your wrist one way, no, that wasn't if you moved it a different way, there was a specific way to test for carpal tunnel. um,
Ah,
but again, a lot of times when we just work on the neck and that big bone area, people's carpal tunnel syndrome, the symptoms appear to go away for a while, because you
you know,
go ahead.
that's interesting. You should mention that because I remember, I don't know, 10, 15 years ago when it just seemed to be an epidemic of everybody having carpal tunnel. and everybody, I was getting surgery on their wrist and all that kind of stuff. And then all of a sudden, talk about self-awareness, the whole medical field was going, wait a minute, it may not be the source of the whatever is not in the wrist. It's the nerves, and where the source of those nerves, which is in your neck, and it goes, we talk about that big bone in BioTouch, the source of the nerves to the upper extremities, and these nerves go all the way down to your fingertips. And all of a sudden they're going, wait a minute, it may not be every single case a symptom of pain in your wrist. It's the cause of something else is causing the pain in your wrist.
Yeah.
Yeah.
And she talked about that repetitive action, sitting around the computer all the time, and and then testing, if I move a different way, what happens to the pain. And that's really BioTouch's self-awareness. And as a practitioner, it's really about that's why we say we don't recommend, we don't diagnose, we just do the touching, and we let your body figure out what it needs to do, how it needs to move, what other therapy you might want to get involved in, or a diet or whatever, and we're going to read this little part from our manual about really the philosophy. It says, let's see, the goal is only to teach an individual how to touch certain points, which will help to facilitate the healing process rather than to do something.
Do something.
Yeah, that's where we get in trouble.
Yeah, exactly. And here's the thought, and you've said this many times, and it's really true. We're not here to fix each other. We're here to love each other and to serve. BioTouch is a true loving service. We're just asked to just have compassion, care about our fellow human beings, and do our part for the whole, which I believe BioTouch is really an amazing gift in that whole package that offers humanity an opportunity, a gift of remembering and stepping into that self-awareness and being able to serve others. I mean, seriously, this is the whole package here.
Yeah.
And bodies get better.
Yes, bodies get better. It really is about trusting that we each know what's best for us. And there's so many options. You can YouTube it, Google it. I mean, you'd go like me dealing with this prostate situation. There's a certain point where you just have to put it all down and just listen. Be self-aware. Be aware of what your body's telling you. What does it need? And then once you make that decision, leap. Trust.
Yes.
Have hope. It's all going to be okay because you're always being taken care of. That's just the way it is.
That's powerful, Paul. That's powerful. Thank you. Yeah.
And BioTouch is such a wonderful healing technique. I mean, there's so many healing techniques coming out there, but the presentation of BioTouch is inspiring. It's refreshing because we're really trying to stop the doing and just be present, especially with another human being who's suffering. You had a great story when we talked about it earlier about a class you were teaching, and there were these massage therapists. Share that with us.
Yeah, it was actually when you and I were still doing the health condition workshops at the center back, a couple of years ago. And we would split up and go into the rooms, and they would practice those sets of points in that particular condition. And I was paired with two massage therapists, and talk about my own self-awareness, okay, which always happens. So one of them was the recipient, the other one was the practitioner. And when she got through doing those sets of points, she immediately said to the recipient, "Did I do enough? Was that okay? How do you feel?" I mean, this whole barrage of, first of all, not trusting herself that she just did what she was doing, right? And expecting, the recipient to say, "Oh no, it was perfect. You're awesome. that is that little ego, that little mind stuff that gets in our way. And so for me, I'm like, oh my gosh, that never happens in BioTouch. We never ask that question. We don't need to. So I told them, I said, this is the beautiful thing about BioTouch. You will never need to ask that question. All you will find yourself doing is saying, thank you for letting me serve you. And they both just, wow. It's really how this is the challenging part of BioTouch, because we're programmed in a different way. Just breathe, let go the need to, need all that feedback from somebody.
Right.
You've done everything that you're supposed to do with those two fingers. I trust that recipient's body knows what it needs, and there you go.
Right.
That's it.
And
they both were like, oh my God, oh, that's wow. Yeah.
It's such a new concept in the healing
Yeah.
modalities.
Yeah.
We get stuck in these loops. We want to create a business. Most of us are trying to create a business, and then we
Yeah.
create that we're the expert or the pro. We have our license, and then you have your recipients or your clients who come, and then they put you in that role. They expect
Yep.
you to tell them what to do. They expect you to know more than they do. And in BioTouch, it's like we have always, I've always said, we're just bozos in the boat. We're all
Yeah.
here. We're all equal. We're all suffering. We're all trying to figure out the best we can do with what we've got. And
Yep.
that's where healing can happen. And the funny thing with this is, as the recipient heals, so do we. It's
That's a
such a
real
wonderful.
relationship.
Yeah, it's a wonderful.
Yeah.
I remember this woman. You talk about self-awareness. We were working on her at Amity. We told the story before, and Amity's a drug rehab community. We were working with women who were getting ready to get their children back. They'd been incarcerated. They were getting ready to get their children back. They did groups every day, group meetings. We'd work with this woman who had a shoulder problem, and every week we would just work on the shoulder, and of course we'd work on the neck and different things. One day she just starts bawling. I mean, tears coming out of her. And what had happened was her self-awareness woke up to the fact that she had been raped and kicked in that shoulder.
In that shoulder. Wow.
And
Wow.
for us as a practitioner, it was a wow. I mean, we felt so
Oh,
grateful to be participating in her self awareness and to be present with her as she came aware of this trauma.
oh.
The pain in her shoulder went away.
Imagine that.
Yeah.
And by the way, the honor of you being able to give her an opportunity to heal. That's what BioTouch, the depths of it
Right.
is like, I didn't do anything. I just touched and gave that recipient the opportunity to heal, go on that journey. Oh, that's just, I love that story.
Yeah.
It's so powerful.
And
Yeah.
from there, she was able to go to the group, talk about the experience, and had worked it out. I mean, a lot of people go to therapy for years and never come that deep into their
No.
self-awareness. So
Not at all. Not at all. That's awesome.
So again, we're trying to share with you, the self-awareness part of BioTouch. Some people call it mindfulness, but it's just being aware of what is right now, and that's just so simple. BioTouch is simple.
I know. It's a challenge.
So we're encouraging you to learn it. We're encouraging you to reach out and touch your loved ones. If you want to make it part of your clinical practice, as we talked about here, it really helps you focus more on whatever expertise you do. If you're a massage therapist, you've done a lot of training, you know the body, you know the muscles, you know the bone structure. BioTouch, I think, can help you crystallize that You know, how do you,
Yeah.
you don't have to give up anything to do BioTouch. If you have a lot of anatomy knowledge, but it doesn't make somebody who has all that knowledge any better or more effective than someone who's never done healing work and has done BioTouch for the first time.
That's that's a lot to take in right
Yeah.
there.
Because
we're not trained for that
no,
thought.
because we're all the same. We're all equal. We all have the ability to help one another. That's really the purpose. We're here is to encourage our self-awareness, to encourage it in others, and you do that by just standing in love, which is BioTouch.
That's
Putting
it.
love into action.
Beautiful.
It's the revolution of love. And
It is the revolution. Wow.
so that's all we need. And it's easy here today. If you're listening to this for the first time, go to justtouch.com. You can download 10 pages. It gives you the greeting, which if all you do is the greeting, you're starting that healing process, that process of self-awareness. If you want to learn more, you can get the whole training manual. It's only $18. If you don't have the $18, get a hold of us. You know, we just want to make sure
Please.
everybody gets a chance to start practicing BioTouch. If you have personal questions, send us an email, office@justtouch.com. We're here to help you take responsibility for your own health care and then pass that on to create a chain that will go on indefinitely.
That's it.
That's it. Yep. So our next, just to give you a little heads up here, our next workshop next month is going to be on insomnia. That was a great little presentation. Martha Lewis with thecompletesleepsolution.com. We're going to do a replay of her presentation and then teach you the points needed to work with insomnia, which is a big thing for a lot of us, especially, you know.
It is a big thing. Yes, indeed.
So again, BioTouch is simple, effective, easy to learn. Let us know how we can help you. If you're listening to this, that's already the first step. So
right, exactly.
Right. So Bev, you have a good time there with your family.
Thank you.
And
thank you, everyone.
Thank you all for joining. Yep. See you all next week. Bye-bye.
Yep. Bye.
If pain has got you down and you live in town, take a trip down to Pima Street. The people down there are people who care. They will get you back on your feet. Put love into action. Put love into action. If you ever want to have any real satisfaction, choose love while you still can. Don't even try to understand. A healing grace in your own hands. Put love into action.